What if the most important moments of your birth weren't fully explained to you?
What if how the system really works could change your outcome?
Well, you've come to the right place. Welcome to Season 4 of the Birth Squad podcast.
We're Dr. Ijeoma Bello and Dr. Kimeshia Thomas. We are two OBGYNs with over 20 years of combined experience, and this season, we're bringing you all the way inside of the delivery room.
In the past, we've amplified the voices of birth warriors.
But now this season, we're adding something different. Our unfiltered perspective as physicians who have seen it all.
We're pulling back the curtain on labor and delivery, the real decisions, the real dynamics, and what actually impacts your outcome.
This is your blueprint.
Welcome to Season 4 of the Birth Squad. Welcome back to the Birth Squad podcast. Today we're talking about a very poignant and important topic, birth trauma. So you might experience someone saying, your baby is healthy. That's all that matters. A lot of women hear that after delivery. And yes, a healthy baby it matters and is deeply important. But what we want to highlight is when the outcome is good, even though the experience itself feels terrifying. A lot of people will say they can't stop replaying the birth, the panic, the confusion, the moment that everything changed. And while everyone around you is celebrating, you're sitting there emotionally overwhelmed, anxious, numb. And so we want to talk about something that doesn't get discussed that often. And that's what happens when the birth feels traumatic.
And I just will be honest with you. This is something that we see all the time. What I often say is that, oftentimes pregnancy is the first time a woman is actually hospitalized in her life. And so just being in that scenario, being a patient, being in that bed, confined, it just feels traumatic, right? You're being medicalized. So, and oftentimes people might go into labor feeling like one kind of experience was supposed to happen. You took the classes, you made a birth plan, and you felt like mentally there was a certain outcome that was going to happen. But then things shift, right? For example, maybe the baby's heart rate drops. I mean, not hundreds, but a dozen staff members, and you rush into the room. The voices are loud. All of a sudden, your zen is like disrupted. And then you're being asked to make decisions very quickly or being told, hey, you might need an emergency C-section. Maybe, a vacuum assisted delivery is needed, but no one fully explains what is happening in the moment because the team is moving fast. And again, this is your first time in this situation. And then afterwards, everyone says everything turned out just fine. But how are you actually feeling internally? Your body and your mind may not feel fine at all. And that's something that we talk about.
Yeah, I do think it's something we need to talk about. And I think it's important that we understand that birth trauma is not defined by a medical outcome. It's defined by the experience that you felt, right? Did you feel powerless? Did you feel ignored? Did you feel afraid and unsupported during one of the most vulnerable times of your life? And I think it's also important to acknowledge that two patients can experience the exact same delivery medically and walk away feeling completely different emotionally, because it's the emotional experience that really matters.
Right. And one of the biggest drivers of birth trauma is actually that feeling of loss of control, especially during emergencies. And from the medical team's perspective, the focus becomes about the urgency and about safety, right? The team is trying to move quickly to try to prevent harm. But from the patient's perspective, it can really feel like there are things that are happening to you instead of with you. And when that communication disappears, even for understandable reasons, fear tends to fill that space instead. And that's where trauma begins.
Yeah, what a great distinction that you made, Ijeoma. I think, that we also have to be honest about something else, which is that not every patient experiences the healthcare system the same way, right? There are disparities in healthcare. So the reason we created the Birth Squad is that there is an epidemic. Black maternal morbidity and mortality is at an all-time high. We're experiencing a health crisis in this area. And so, there are real disparities in who feels heard, believed, informed, and supported during labor. And it's not just, Black women, it's people in multiple marginalized communities. Sometimes their concerns are being dismissed, sometimes communication is less thorough, and sometimes patients feel like they're just not being included in the decisions that are being made about their own body. And those experiences absolutely, right, increase the risk of birth trauma because it's not just about one bad interaction. It's about this larger systemic patterns that we see in maternity care.
Yeah, so I really just want to say this very clearly. So, in case no one from the medical system have told you this or you have not heard this out loud, I want you to know that a healthy baby does not erase your traumatic birth. Both things can be true at the same time, and they deserve to be acknowledged and addressed.
Absolutely, absolutely. So, what should you do, right? I think that's empowerment is always important. What should you do if you feel your birth experience was traumatic? Number one is this is what we're doing right now. We're acknowledging it. You don't have to minimize your feelings just because the outcome was medically successful. Okay. The second thing we want you to know is that you should talk about it. Talk to your provider, talk to a therapist, talk to someone you trust. And if you need clarity, ask for a debrief, right? In medicine, what will often happen is when we have an adverse outcome, we do a debrief. But the unfortunate part of that is that usually the debrief only includes the medical team. So the patient isn't even a part of those debriefs, but we recognize as a healthcare system that maybe it was a what we call a near miss, but something happened that we have to talk about to make sure we are addressing it correctly and we did the right thing. And we need to make sure we are offering patients that same type of support. So, how can you do a debrief? Well, you can ask questions like, what happened? Why were those decisions made? Is another great question. Was there another option? So, also understanding that timeline can help allow your brain to process the experience instead of constantly replaying it.
And I think, going back to that debrief, it's important to have the important stakeholders, right? The people that were part of the decision or the scenario that happened. Yes, there can be documentation in your medical chart, but sometimes you might need to name specifically, hey, I'd like to speak to the delivering provider. I'd like to speak to the nurse who was taking care of me during that postpartum period because I want to ask specific questions. And to be honest, because of the way that the healthcare system works, that person who was part of your care may not be there the next day. So it's important to kind of just take note of names, right? So that later on, even if it's after you leave the hospital, you can still get those questions answered by your healthcare team. Something else that we should really pay attention to is those feelings that someone has postpartum.
Mhm.
There can be intrusive thoughts, anxiety, that overwhelming sense of panic, and maybe even like avoiding conversations about the birth because, again, it feels traumatic and you don't want to relive it. And then sometimes, as a result, feeling emotionally disconnected. These are things that you should not ignore, okay? Because birth trauma does not necessarily end just because you've left the hospital.
So
It
true.
can affect your bonding, how you're sleeping, your recovery, future pregnancies, and then postpartum mental health overall. When it goes under addressed or not addressed at all, it tends to linger very quietly in the background and affects your frame of mind, your thoughts, and decisions in the future.
I think this is something that our midwifery colleagues do very well. They're trained in recognizing and addressing birth trauma. And unfortunately, as OBGYNs, we don't get that training consistently. And so it's not a skill that all of your providers may have, but I still encourage you to try to have those conversations. I think, our field is moving in a direction where we are acknowledging the fourth trimester, and a part of that fourth trimester is reflecting on your birth experience. So a lot of institutions and systems are moving towards earlier screening and check-ins with your healthcare provider. And those are those opportunities to be able to discuss that. And I don't want you guys to feel that you're being rushed, right? Like if you need extra time, ask for an additional appointment with your provider. If you don't feel that they are able to give you the time that you need to talk about it, because birth is not just a medical event. And I think we lose sight of that, but it's emotional, it's psychological, it's physical, it's all of those things at the same time. And when you experience something like that, it feels frightening, it can feel chaotic or out of control, and it can leave a lasting impact, even if you have a good outcome, a quote unquote good outcome, and your baby is healthy. So advocating for your provider to be able to create a space to talk to you outside of how am I physically feeling and how do I look and feel, I think is important. And you are allowed to name that experience. You are allowed to process it and you deserve the support while you're doing it.
Exactly. And I think even, outside of your provider, there are professionals who are specifically certified to talk about perinatal, post traumatic births. Right. And I think it's really important to really dig into those resources as well, because those individuals can help you in the long term, right? Because again, this is not going to just be resolved with one or two conversations with your provider. There may be needing more sessions and maybe months or years worth of discussion to kind of get through all of this. Because ultimately, taking care of your mental health is not separate from taking care of you or from taking care of your baby. It's all one and the same. And that conversation, we're started, and I think it's important to keep it going. And so, we're so happy to be able to just name it, to acknowledge it. Just know that we see you and your experience matters. So let's talk about it.